I think it would be safe to begin from here.
Okay, sounds great.
Perfect. Well, thank you everyone for joining. My name is Andrew Hardy. I'm a wealth advisor working with Frank Fantozzi here at Plan Financial Services. With me today is Radhika Kalata. Radhika is a life and health advisor with Insurance Systems Group. She has been in the industry for over 20 years and has been a senior market specialist for 12 of those years, having extensive knowledge in Medicare. At this time, I would like to pass it over to Radhika to allow her to present. If you have any questions at any time during the presentation, please use the chat box below to type out that question. We will be reviewing all questions at the end of the presentation. Radhika, take it away.
Yeah, thank you so much. Thanks to everybody who is able to join us today. I'll go over the information on Medicare again, like Andrew had stated. If you have any questions, please feel free to just pop those in the chat box, and then we will address all the questions that you may have at the end of the presentation. So without further ado, let's start talking about Medicare, and basically really the overview of what we're going to be touching base on are basic information on Medicare. What is Medicare? What is your A? What is your B? What do you get when you get that red, white, and blue card in the mail? And just try to help simplify the entire process for you. So things that we will learn about and talk about are the basics, some terminology. Medicare loves their acronyms and it kind of throws everybody off. Different enrollment periods, some of your plan type choices, plan recommendations, and even some cost assistance plans that are available to some individuals. The overview of what we're going to touch base on is your Medicare A and B and what that coverage is, original Medicare eligibility, some costs associated with the original Medicare, how to apply and enroll, and what your additional Medicare plan options are. You know, Medicare can be complicated, so the more you know, the easier it will be to choose the plan that's right for you. But that's what we're also here for, to help guide you and answer those questions so that you're fully educated on what all your plan choices are. What is Medicare? So most, I'm sure, understand that it's a federal health insurance program. It's run by CMS, Centers for Medicare and Medicaid Services, which is part of the U.S. Department of Health and Human Services. Things that we're going to take a look at in addition to the different parts of Medicare is what is a premium, your deductible, your copay, coinsurance, and how that all kind of ties in together. Original Medicare, when you get that red, white, and blue card, it will give you Parts A and Part B. Original Medicare covers many, but not all healthcare related services, which is something that we will take a look at. So original Medicare Part A, which is your hospitalization. So what that covers for you is inpatient hospital stay, skilled nursing, hospice care, and home health care. For most individuals, Medicare Part A is not going to have a premium for it, because as you're working, as you're paying your FICA taxes, that actually pays and covers your Part A coverage for you. So as long as you have, you know, the equivalent that you need are 40 work credit hours. So as long as you have that at the time of retirement and enrolling into the Part A, it will come to you at a zero premium. And then there are some that, you know, if they do not have the full 40 work credit hours, they're able to buy into Medicare. Most individuals are not going to fall into this situation, but if you do, there's a scale that will say, okay, based on how many work credit hours you have, that will determine what your Part A premium will be. If this is something that is significant to you, we could always look at what are those work credit hours and then confirm what exactly your Part A premium would be. But again, most individuals are not going to fall into this situation. Original Medicare Part B. So anything that's going to be done on an outpatient basis, your doctor visits, outpatient care, home health care, which kind of is coordinated under both the Part A and Part B, your durable medical equipment, some preventative services, such as, your certain vaccines and cancer screenings. And then what I also, that's not listed on here that I always like to kind of add in is that it under Part B would also cover your emergency room stays. So emergency room is all done on an outpatient basis. So if you go into the emergency room, you're treated and you're sent home, all of that will get billed under Part B. If once in the ER, that now becomes a situation where you need to be admitted, and then they kind of take all that care, flip it over under the Part A side of things, and then your Medicare Part A would cover it. But Medicare Part B is what you will see a premium for. And this is a little outdated. So for 2020, your Part B premium was $144.60. The 2021 premium is $148.50. This premium is based on earnings. So what Social Security will do is they will look at your last 3 years prior to enrolling into Medicare Part B, and they will take an average of the 3 years and they will determine your Part B premium based on that annual figure. So many will pay the standard premium, but if your earnings are higher, you could potentially pay a higher premium for your Medicare Part B. If you have any questions on what that might pertain to you, with working with Frank's office and myself, we could always help give you a copy of that schedule so you would have a better idea of what you potentially would get charged for. Original Medicare eligibility. So who is eligible for Medicare? Most individuals, when you're turning 65, that's kind of, the gold standard of when you get to age into Medicare. But there are some circumstances, such as if you're under the age of 65 and have certain disabilities. If somebody is under the age of 65 and they have been deemed fully disabled after 2 full years of disability, they will automatically be enrolled into Medicare. And then individuals, regardless of age, if they have been diagnosed with end-stage renal disease or ALS, on the different months of diagnosis, they're able to be enrolled into Medicare to help cover those costs. U.S. citizens and then a legal resident has to have been in the United States for at least 5 consecutive years to be eligible for Medicare as well. So how do you get enrolled into Medicare? So typically you would have 3 options. One would be going into your Social Security office, applying online, or calling into Social Security directly. With COVID, all of the Social Security offices have and continue to be closed. They are doing some appointments on a needs by needs basis, but most things are really being handled through their online enrollment and through Social Security. I would always recommend try to do what you can through getting enrolled online, just because obviously the wait time and the call time on the telephone, it is a longer, lengthy process. But if you have questions on how and where you go, ssa.gov is the website. If you do not or have not signed up for an enrollment login profile under Social Security, I would recommend that you go ahead and do that. There's plenty of important information that's pertinent to you that would be available on Social Security's website. That I think it's important for everybody to have access to it. But once you're enrolled into your login, that's where you're able to go and enroll into Medicare from there. Your enrollment period. So what is your initial enrollment period? So this is for individuals who are just aging into Medicare on a natural basis. So you're turning 65, which makes it your initial enrollment period. So you actually have 7 months to enroll into Medicare and make a plan choice of what you'd like to pair along with Medicare. So it's the 3 months before you turn 65, the month of your 65th birthday, and then 3 months after your 65th birthday is when you're able to enroll into Medicare and pick up, again, a plan that you'd like to pair alongside with it. Your original Medicare enrollment periods. So there's a general enrollment period. So if you do not sign up for Medicare A and B when you're first eligible, you're not eligible for a special enrollment until January 1st through March 31st of each year. This is really for individuals who do not have a secondary plan. So if you are currently working and you have group health insurance available to you, this does not apply to you. This is for the individual who only has Medicare available to them, but for whatever reason chooses not to enroll into Medicare Part B, or even for Part A if you had a premium that you were responsible for. And if at a later point in time in the year you decided you wanted to pick up Medicare Part A and B, again, you would have to wait until January through March of the year. And what this slide doesn't show is that you can enroll into Medicare at any point between, well, it does show it. It shows that your your coverage wouldn't begin until July 1st. So enrollment would be from January 1st through March 31st, but you would still not be able to pick up a secondary plan until July 1st. And again, if you have credible coverage through an employer, or if you have an individual policy through the ACA that you're enrolled in, this general enrollment period would not apply to you. Special enrollment periods. So again, the last thing that we kind of reviewed, that would put you in a special enrollment period. Other things that would give you special enrollment period is you are working, you have group coverage through your employer, but you are either looking to transition off of your employer coverage and pick up your own plan through Medicare. That would put you into a special enrollment period. If you are now after the age of 65 retiring, so you delayed enrollment into Medicare. So you're enrolling into Medicare and you're coming off of the group plan, that's also a special enrollment period. Or, if you already are enrolled into Medicare, but now you are moving from one state to another state, or even from one county to another county, if the plan that you're currently on is not available to where you are moving, that would throw you into a special enrollment period as well. When will your coverage begin? The first month following enrollment. So, and really when you have a special enrollment period, that also gives you a 60-day grace period of being able to pick and choose what additional plan you would like to enroll into. And then that would always take effect the first month following your plan choice. What your additional Medicare options are. Eligible persons can choose additional healthcare options. So we're going to kind of go into what those options are. We were just looking at what original Medicare is and what you get through them. And now we'll kind of compare what you could put alongside Medicare to help cover your costs. So here it shows 3 different options. There are some additional ones in addition to this, but your first option is keeping original Medicare as your primary coverage. So Medicare Part A, your hospitalization, Medicare Part B, which is your doctors and outpatient services, So what you did not see us talk about is prescription drug coverage, because that is not something that Medicare will cover for you. So you would need to pick up a prescription drug plan. Now, there are some medications that need to be administered in a healthcare facility. And a lot of times those medications themselves can be billed through Medicare Part B. So for some situations, Medicare will help cover medications, but your routine medications like your high blood pressure, your cholesterol, your maintenance medications that you're taking at home, Medicare would not cover. So again, you would need to pick up a standalone prescription drug plan to help cover those for you. Your second option is, again, keeping original Medicare as your primary coverage, adding a Medicare supplement to come alongside it. So if you're doing any reading and you notice there's some literature that refers to this plan offering as a Medicare supplement, or you see it referred to as a Medigap policy, that is exactly the same thing. So what it is that you pay a monthly premium for a supplement. What Medicare doesn't cover, your supplement would cover for you. So you're budgeting your healthcare on the front end by paying that monthly premium every single month, so that you don't have to necessarily worry about your medical expenses on the back end. And since a supplement is only supplementing Medicare, so your Part A and your Part B, you would still need to pick up a standalone prescription drug plan to help cover your medications. The third option is doing a Medicare Advantage plan. And what that does is it takes your Medicare Part A, your Part B, and your prescription drug coverage, and it puts it all into one plan referred to as a Medicare Advantage plan. So prescription drug plans, Part D, D standing for drugs. The government does require that you have minimal drug coverage. Most employer plans, if anybody on here is still insured through your employer plan, should have their coverage meet the federal guidelines for the minimal drug coverage. Every year they would have to provide documentation showing that your coverage is credible. But again, that's also why you need to either have that standalone prescription drug plan or a Medicare Advantage plan that will help cover your medications for you. Most prescription drug plans, if on standalone basis, will have monthly premiums. You'll have co-insurance amounts or tiered co-pays. So really typical of what a group plan would be. And again, two different options of being able to pick up your prescription coverages, either on a standalone basis or by enrolling into a Medicare Advantage plan. Your Medicare supplement insurance, again, can also be referred to as a Medigap policy. And again, this just helps cover what original Medicare doesn't cover for you. So if you have original Medicare and a supplement in place, Medicare is always going to pay first. What Medicare does not, if Medicare pays, your supplement is going to pay. The portion that Medicare does not cover for you would get billed over to the supplement, and they would pay the remainder costs for you. And again, you're budgeting your healthcare on the front end by paying the associated monthly premiums. All supplemental plans are sold by private insurance companies. Premiums can vary by state and by plan. Some can require underwriting. So this is always a big question of, some individuals say, well, we thought that plans couldn't be underwritten anymore. And when would underwriting come into play? If you are aging into Medicare, so you're turning 65, you're in a guaranteed issue situation. So there would be no underwriting if you were choosing a Medicare supplement. If you are currently insured under a group plan, and now you are coming off of that group plan and enrolling into Medicare, and you choose to pick up a Medicare supplement, that's also a special election period for you. And therefore you are also guaranteed issue. So there's no medical underwriting. If you are already enrolled into a Medicare plan, a Medicare Advantage plan, and you've been on that for several years, and you decide that perhaps a Medicare supplement is something that you want to transition into, that's when the medical underwriting would come into play. Again, it says often paired with the original Medicare. You would need to have Medicare A and B to be eligible to pick up a Medicare supplement, and then a prescription drug plan. What you cannot have is you cannot have a Medicare Advantage plan and then pair up the supplement alongside it. Because once you enroll into a standalone prescription drug plan, that actually will take over your Medicare Advantage plans. It's one or the other type coverage. Your Medicare Advantage, so Part C, and this is where I always kind of like to point out. So on here, you see that it says Part C, and I always get clients who say, okay, I have my A and my B, I need my C and my D. D is for drugs, and again, it's either you're going to pick it up on a standalone basis or you're going to enroll into a Medicare Advantage plan. Medicare Advantage is not a part of Medicare. I really wish that it would really almost just say option, because that's exactly what it is. It's an option to Medicare. So again, your first option is having original Medicare A and B as your primary, picking up a supplement, and then a standalone prescription drug plan. So that's option one. Option two is going into a Medicare Advantage plan where it takes all of those benefits and it rolls it into one plan for you. So I know that that can be really confusing for a lot of individuals. So again, you have some Advantage plans that do not cover prescription drug plans, and that would be more for individuals who have access to VA benefits. But otherwise, you'd want to make sure that you're looking at the Advantage plans that do also cover prescription drug plans. Monthly premiums can vary. So there's plenty of Medicare Advantage plans that's a zero premium. And then there's some plans that have, a premium for the plan, and it's all based on the carrier and the associated costs that they have built into the plan. But technically, the way the Advantage plans work is that you're really not paying to have that coverage. Because if you enroll into a Medicare Advantage plan, the carrier that you are insured through, they receive your Medicare Part B premium. So they are responsible to handle all of your claims. And the way the plans work is that you will have associated co-pays across the board on anything that you would need to have done. All of the Advantage plans then have an annual out-of-pocket maximum. So as you're using the plan, as you're paying your co-pays, and they get accumulated, if and when you reach that annual max out-of-pocket, anything above and beyond that would be covered 100% for the remainder of that plan year. And then your Advantage plans do have networks for doctors and hospitals. So you would want to make sure that you're looking at the plan that you are interested in and make sure that who you want to be doctored with and at is in network with that provider. So here where it says typically guaranteed issue, prior to 2021, there was one medical question on the applications, and that was if you had end-stage renal disease. If the answer was yes, you were not eligible to enroll into the Advantage plan. As of January 1st of this year, that has been eliminated and no longer a question that needs to be answered. So it's always guaranteed issue, and it doesn't matter what you have going on. A carrier would always have to accept your enrollment. Private insurance companies are the ones who service and offer the plans, just like the supplemental plans. And again, you must be enrolled into Medicare Part A and B to be eligible for the plan. So we have different Medicare enrollment periods. Your initial enrollment period, where we kind of went over that 7-month window of time, your different special enrollment periods, and then we have your annual and your open enrollment periods that we'll review as well. So again, your initial enrollment period, 3 months prior to your 65th birthday, the month of your 65th birthday, and then 3 months after. Medicare supplements are a little bit different, where it's it's open with Part B effective date and closes 6 months after. So your guaranteed issue status would actually go up. With some carriers, it's actually a little bit longer, but most carriers, 6 months after your 65th birthday, they still look at that as your initial enrollment period, whereas your Medicare Advantage and prescription drug plans, your initial enrollment period is only the 3 months. Special enrollment periods, again, moving out of state or county. If an individual is a lower income where they would be eligible for Medicaid benefits as well, that would throw that individual into a special enrollment period where they would be able to reevaluate their current plans and take a look at what additional plan offerings are available to them. Somebody who's recently retired or coming off an employer group plan. So you do not have to officially retire to be able to pick up Medicare A and B. You can still continue to work and make the choice that going on Medicare would be more advantageous for you. So you continue to work, but then pick up your Medicare coverage and then a secondary plan from there. But what's important to note is that COBRA is not considered credible coverage. So for an individual who has access to COBRA benefits, and if you decide, okay, you're no longer going to work, but you're going to take the COBRA benefits and run that out for the 18 months and then enroll into a Medicare plan or even into Medicare A and B, please note that COBRA is not credible. And this would throw you into that general enrollment situation where you would have to wait until January through March to pick up your Medicare A and B, and then have to wait until July 1st to make a plan choice from there. And then what also here, it says retiree health plans. So there are some retiree health plans that an employer can offer. Again, there are many that are credible, but there are some situations where that retiree health plan may not be credible under Medicare. So if you have that option available to you, then you'll just want to just have somebody review it to make sure that you are making the right choice as far as that goes. And then your annual election period, and this is for individuals who have already aged into Medicare. Every single year, there's an annual enrollment period, and that is from October 15th through December 7th. And this is where you are able to evaluate the plan that you're currently on, review how it may potentially be changing for the next coming plan year, but then also compare it to everything else that is available to you. This is also, for individuals who have medications that they may be taking, an important thing for you to be doing to kind of look at how is your current plan, how is that formulary working for you, and how can it potentially, is there a more suitable plan that you can transition into for the next coming year. If you have not done this in the years past, I would highly recommend it. It's always important to make sure that you're fully educated on how your plan is working and what else is available to you. So Medicare, your open enrollment period, this was something that was available years past. And Medicare just recently, over the last few years, brought this enrollment period back. Many do not know or hear about it. As brokers, we're actually not allowed to advertise or discuss this. Medicare has been doing more educational seminars on this, and it's sending out information so Medicare recipients are aware of this enrollment period that's available to them. So this runs from January 1st through March 31st, not to be confused with the general enrollment period for the individuals who have chosen not to enroll into Medicare once they were eligible. This is a totally different enrollment period, even though it kind of runs right along the same time frame. But this is for individuals who are on a Medicare Advantage plan. So if you did not have the opportunity to kind of review your Medicare coverage and compare how that would potentially change for you in the next following year, then from January 1st through March 31st, you are allowed a one-time opportunity to switch from your current Medicare Advantage plan over into another plan, or you can disenroll from your Medicare Advantage plan, switch back to original Medicare, and then pick up a prescription drug plan and a Medicare supplemental plan from there. Medicare cost assistance. So again, for some individuals, and you don't necessarily need to be eligible for Medicare and Medicaid, we have other assistance plans that are available. The Extra Help plan is something that is available through Social Security. And it's, of course, they're all based on income and things like that. But a lot of times clients aren't aware that they may potentially be eligible to have their overall prescription costs adjusted and lowered by using the Social Security assistance program. You have Medicare savings programs that are available, and then program for all-inclusive care for the elderly, which is PACE. That this kind of goes over not just on the medical and the prescription side, but it kind of tries to help to bring all different assistance plans together in one place for individuals. Again, if you have any questions on if any of these services are available to you, we're here to help answer those questions. So I know that we kind of reviewed a lot of information in a really short, brief time. We are getting close to the annual enrollment period. This is the time where I kind of like to touch base with my clients that says, hey, take a look at where you're at, you know, if you're already in Medicare. And if you're getting close to aging into Medicare, these are some of the things that you want to start asking yourself and kind of start reviewing, you know, what is your budget? Who are your doctors? You know, what networks are available to you, your prescription costs, your drug costs, your frequency of care. So when you're, you know, looking between a Medicare supplement and a Medicare Advantage plan, take that into consideration on which would be suitable for you. Your likes and dislikes. How do you want your health coverage to work for you? And then finding that plan that would suit the needs that you're looking to ensure. Your travel habits. And I'm sure that there's plenty of other questions that, you know, get thrown out and reviewed. But as a licensed agent, this is something that I sit down and I review with all my clients. I am a broker, which just means that I'm licensed and contracted with all available carriers across the board. So on the supplemental side, you know, there's 30 plus different carriers that are available. On the Advantage side, depending on what county you're in, on average, 70 to 77 different Medicare Advantage plans, at least for this current plan year that's available. On your standalone prescription drug plan, 30 to 33 different plans. So, you know, you want to make sure that you are looking at all of that. And that's, again, because I'm licensed and contracted with all carriers, I'm able to kind of dive into those plans and would be able to help educate you on what your plan options are. And then trained to assist you in choosing a Medicare plan. You know, every year as a licensed agent, we are required to get certified. So we're required to do an AHIP certification that just says that we're licensed and contracted to be able to operate into the Medicare space. But then for every carrier that we want to represent, we have to do their annual certifications and training as well. Offer services at no cost to you. So with operating in the Medicare space, an agent is never allowed to charge a consultation fee to help answer questions and help guide you along the way with regards to choosing what plan option is best suited for you. You know, we're here to educate. That's my number one job, is to make sure that you understand what Medicare is. When you get that Medicare card that says A and B, that you have some understanding of what you're getting for those for those benefits, and then what your additional options are. So again, that's my number one job, is to make sure that you're fully educated, and that you know what, again, you know what your options are, because it can be confusing and overwhelming. But in a gist, that's pretty much the share of it. So I'm going to stop sharing my screen, and then I see that we have some questions, and we can kind of go through those. There's a question here that says, my employer has a high deductible. What will Medicare cover? And will I need to meet that deductible before Medicare covers anything? So two things. If your employer is under 20 employees, you still need to enroll into Medicare Part A and Part B. And the reason for that is because Medicare will be your primary coverage, and then your employer will be secondary. If your employer is over 20 employees, you do not need to enroll into Medicare Part B. If you have a high deductible plan, and that is, you have an HSA account that is associated with that plan, if you are continuing to contribute to that HSA, you need to make sure that you advise Social Security that you do not want to be enrolled into Medicare Part A either, even though that's available to you for no premiums, because you will be penalized for contributing into an HSA plan and being enrolled into either Medicare Part A or Part B. So you can only do one or the other. If it's just a high deductible plan and there is no HSA associated with it, and it is over 20 employees, I guess it just, the answer would depend on, are you picking up Medicare or not, and how many employees are part of your group plan. So would Medicare be primary, or would Medicare be secondary? You could either type in more additional information, or again, feel free to reach out to me and I can give you more specifics on how that would relate to Medicare. Over 20 employees. Okay. So then again, Medicare would be secondary. And then the question would be, would you choose to pick up Medicare Part B or not? From there, because you don't have to.
And Radhika, on top of that, I have if I am eligible for Medicare but still working, do I need to enroll into Part B?
So the question is, no, you do not need to enroll into Medicare Part B if you're still working. Again, if it's over 20 employees. If it's under 20 employees, then yes, you do still need to pick up the Medicare Part B. I would always recommend you compare the both. So again, I always like to make sure that my clients are fully educated on what's available to them, one way or the other. So, taking a look at not just what your premium is that you're paying for your group coverage and comparing that to what the premium would be if you enrolled into Medicare, but then also comparing the coverage. So comparing your deductibles, your maximum out of pockets on the group coverage, and comparing how picking up a Medicare plan would correspond between the two, and just, again, making sure that you're fully educated on what all options are, because there's sometimes I've had clients who benefited from coming off of their employer plan. There also have been times where, reviewing the summary of benefits with the client, I advise that they continue to stay on their group plan until they were ready to officially retire and come off of it. And I just wanted to add, I didn't kind of touch base on this, For an individual who may have delayed enrolling into Social Security, so you're not collecting your Social Security benefits, you will not be in their, they know who you are, they know that you are eligible for benefits, but you will not automatically be enrolled into Medicare A and B. That is something that you will need to proactively do on your own. So if you are delaying enrollment, you are not collecting or contributing to an HSA account, then you'll have to actively enroll into Social Security benefits or Medicare Part B. But again, when that time comes, and if that's a question that anybody has on how that works and what steps they should take, I'm here to help answer those questions.
Excellent. And yeah, that was the follow-up was, will there be a penalty for not taking Part B or D if I choose to stay in the employer plan?
And as long as it's over 20 employees, there will be no penalty. If it's under 20 employees, you would need to pick up Medicare Part B. You do not need to pick up Part D because your group plan should have credible coverage associated with the group plan. Then also, asking your employer, if it is somebody who's under 20 employees, if you're still eligible to remain on their plan, because some employers with employees less than 20 lives, they legally can tell you if they will allow you to continue on that group plan or not.
Excellent. Now, I have a question from Jeff, and this question is, if a client has a significant chronic disease, how do you determine what advantage or supplemental plan is best?
So really kind of discussing what that chronic disease is and what the care is that would be required. I try to be really careful on giving my opinion on what kind of coverage somebody should take. But my job definitely is to, ask the right questions on, looking at things of, okay, for anybody, chronic disease or not, if you were to look at the last 3 years and the next upcoming year is an average of the last 3, what can we expect medically? And then have that help guide us as far as what plan choice would be most appropriate. And if it's somebody who's in a guaranteed issue state, perhaps going into a supplement where you know exactly what you're going to pay towards your health coverage, and then knowing that anything that you need covered medically would be covered in full by paying that premium. But again, it's taking a look at, chronic disease, but is it just maintained through medications? Or is it a situation where there's a lot of routine medical appointments and procedures that is required? So, I could give more personalized information and feedback once I would know exactly what that is or what that would look like. And then just, again, help kind of taking a look at, okay, if you're on a Medicare supplement, what is the cost of that Medicare supplement? And again, your Part B premium. And then if you're on a Medicare Advantage plan, what do you expect your medical situation to be? Look at what those potential co-pays under a plan that you were interested in, and then outweighing the both between the two. So I see, hopefully that I answered that question. If the individual that asked the question wants a little bit more personalized detail, please feel free to reach out, because I know HIPAA and just personalization, there's some things you don't want to specifically talk about, but I'm here to help answer more specific questions if needed. I see that there's a question, what is Part C and how do I get it? So again, Part C is a Medicare Advantage plan. I really dislike that they refer to them as a part, because everybody thinks that, it's a part of Medicare and it's something that is needed. It's an option to Medicare. So if you have Part A and Part B, which is what you get from original Medicare, Part C is a Medicare Advantage plan. So that is an option to that you can help pair alongside Medicare. And then how do you get it? By looking at your available Medicare Advantage plans that are available to you in the county that you live in, comparing, if you have a list of medications that you are taking, doing a formulary review. For a lot of my clients, I will do a formulary analysis where I am just comparing all the different formularies across the board with the Medicare Advantage plans, and then kind of taking a look at your top most suitable plan options to help determine which one would be your best option to go with. And then we would choose that whatever carrier makes the most sense. And then there is an online enrollment platform that we would be able to enroll you into from there. But again, Part C is not a part of Medicare. It's an option to Medicare.
Now I got another one that came in from Sue. She asked, I qualify for special enrollment. Do you help sign up for Part B? And how do I prove I now have credible coverage? I received Part A automatically and turned down the option for Part B due to having the other coverage.
Okay, yeah, so I can definitely help guide you on how to get enrolled into Medicare Part B. That's not something that I can physically do for you because I don't have access to your Social Security account. But if needed, we could always do a Zoom meeting and I could kind of help guide you through the website or just talk you through it. There are some forms that you will need to have filled out. So if you are on an employer plan, which is why you delayed enrolling into Part B, there's actually 2 forms that you'll need to fill out. There's a form that you personally need to fill out that says, you specify what month you want to pick up the Medicare Part B. And then there is an alternate form that your employer would need to fill out that just would specify that from the date that you're eligible for Medicare, you have been actively enrolled on their plan, which is credible. And then that will deter you from incurring any kind of late penalties. I do have both of those forms. So if you need and want, I could always, if you want to give Andrew your email, I'd be more than happy to forward those, or I could forward the forms over to you, Andrew, and you can pass them along, whatever would be easiest. To help with that. But yeah, I'm here to help, answer any questions and help you figure out how to get into Enrollment Part B. And then once you have those forms completed, there's an online link on Social Security's website that I can also help guide you to on uploading. And that's the easiest way to get these forms over to Social Security. They have a fax number as well, but I always find doing the upload easier and quicker.
Perfect. Now, another question came in, is anything not covered in Medicare Advantage?
Medically, as long as it's something that Medicare approves, the Medicare Advantage plan is going to cover it. If you have a situation where you are enrolling into a trial basis to, to try to take care of a certain health condition, that would not be covered. So it has to be an FDA approved procedure that Medicare would approve as well. Then the Medicare Advantage plan is going to have to cover it for you. What you also get with the Medicare Advantage plan, some things that you do not get with original Medicare. Many Advantage plans are going to cover, eyeglasses, if you watch TV enough, people know, they see, these commercials, and I get a lot of clients who say, what do I have all this stuff, free stuff that they're giving? So with the Advantage plans, it's kind of like a full encompassing plan. So you'll get some vision coverage, some dental coverage. A lot of them are adding hearing aid benefits, even over the counter benefit dollars to help give you funds to purchase, like your vitamins and your pain relievers and bandages and things like that. But an Advantage plan has to cover at the same level as original Medicare. And sometimes they cover a little bit more in certain circumstances. So I don't think that you would find yourself needing anything medically that an Advantage plan would not cover for you.
I don't have any other questions on my end, but we'll give it a minute just to see if any more questions filter in.
Great. Yeah. And so I'll just throw this out there that for anybody who's, whether you're on an employer plan, if you have employers that have tuned in or, that you speak with that, are wondering how their plan compares to what potentially may be available to an employee who has access or has the opportunity to look at their Medicare options, I'm always here to help review those. So anytime I have an employee that is eligible for Medicare, I always do a full review of comparing what their current group coverage is, looking at the premium, looking at your deductible, what your copays are, what the maximum out of pocket is, and then offering the comparison on what would be available to them through original Medicare or a Medicare Advantage plan. For the individual who is already on a Medicare plan, whether it's a supplement and standalone prescription drug plan or a Medicare Advantage plan, like I said, we're about to get into the annual enrollment period. If you have not reviewed your plan and the formularies on your current coverage in the past, I really would recommend for you to do that, especially with there being such an extensive number of plan choices. You always want to make sure that you're in the best plan possible based on what your medical needs are. So again, one resource that I use a lot is Medicare's website. That gives you the option to kind of review everything. But again, I have a lot of clients who know that I kind of geek out over that information. I like to do a full analysis across the board. So if that's something that you think would be advantageous, I'm here to be able to do that for you.
And then one other question came in is, how can they contact you?
Yeah, so my direct number is 440-530-0506. Or my email is rkoloda@inssys.com. I think that if everybody has access to the chat box, I will put my information there as well. And if you have any questions, you can get a hold of me that way, or reach back out to Andrew and the team, and then they'll be able to refer you over to me also. But that would either cell, and that's my cell number, so I always have it on me, or my email.
Excellent. Well, I wanted to thank you for your time, Radhika. This was amazing. It doesn't appear that any more questions are coming over, but they have your contact information now that they can reach out to you directly or reach out to me as well to get to you.
All right, sounds great. Thanks so much for your time and for everybody's time for coming and spending the hour with us. I appreciate it.
Perfect. Excellent. Well, thank you again, and feel free to reach out, everybody in the participants attending this webinar. Feel free to reach out to me or Radhika again with any further questions. look forward to hearing from you guys.
Have a good day.